Hello and welcome back. This is part 4B of Unit 10 UGC NET JRF Forensic Science. In this part, we will discuss about sex determination and age estimation. Starting with the sex determination. So, amylogenin is a protein found in human enamel. On MLX consists of 106 base pairs, whereas MLY consists of 112 base pairs. So MLX is found in females and MLY is found in males. So there is a difference of 6 base pairs respectively. Now the fusion reaction, it is to differentiate the X and the Y chromosome. So in the presence of acriflavin Schiff reagent, X chromosome is observed as a bright yellow spot. Another thing is sex chromatin or Barr body. It is present in nuclei of leukocytes of females. So females have 2 X chromosomes. So one of them get inactivated and present in the form of Barr body. So in females only this is observed. The Barr bodies are found in hair follicle in a portion of 2965, and the Barr body count is performed by Orson and acriflavin reagent. Barr and Bertram discovered nuclear sexing in 1949. So along with the Barr body, a Davidson body is also present only in females. So it is a nuclear drumstick like attachment located in the neutrophils. Now in human mandible, mental tubercle is large and prominent in male as compared to that of the female. And when a female gave birth, so there are some changes in the female pelvis. So a preauricular sulcus is prominent in females, and it is the characteristic of female pelvis who gave birth. So in the females who gave birth, the anterior sacroiliac ligament is prominent due to the trauma during the course of delivery. So there are some syndromes that are Turner syndrome, in which there are 45 chromosomes. It is also known as female hypogonadism, X0. 1:2500 girls are suffering from this syndrome, in which at a place of 2 X chromosome there is only 1 X chromosome, and there is primary amenorrhea, that is absence of menses at age 15, but the growth is normal and the secondary sexual characteristics are there. Only menstruation cycle is not has not begun. Another one is Swers syndrome, in which there are the number of chromosomes are 46, but the sex glands are not developed. Then we have Down syndrome or mosaicism, in which there is a mixture of XX and XY. In Klinefelter syndrome, there is one extra X chromosome, that is 47 chromosomes are there, XSY. So this is known as male hypogonadism. Some interrelated terms, so we will not get confused. The old term is male pseudo hermaphrodite. The new term is 46XY DSD or disorder of sex development. Old term is XS male and new term is 46XX testicular DSD. True hermaphrodite, ovotesticular DSD. Female pseudo hermaphrodite, 46XX DSD. Now the presence of gonads and types of intersex. So gonadal agenesis, where when the gonads are absent. Gonadal dysgenesis, when the gonads are present but they fail to develop. True hermaphrodite, whereas wherein the gonads of both the sexes are present. Pseudo hermaphrodite, difference of internal and external sex organs in the same individual, having so the individual have both the characteristics, half of female and half of male. Now the sex determination through skull, the traits, the size of the skull in male is large and the female is small. Architecture, the texture, the male skull is rugged and female skull is smooth. Supraorbital ridges, the eyebrows ridges. In males these are well developed, in female these are smaller. Mastoid process, well developed in male and smaller in female. So these are the supraorbital ridges and this is the mastoid process. Now the orbits where the eyeballs fit in. So these are square, lower, relatively smaller with round margins. In females it is rounded, higher, relatively large with sharp margin. The cheekbones are heavier, more lateral arched in males and lighter, more compressed in females. The mandible or the lower jaw is large, higher symphysis, broader, ascending ramus and everted in males, and small with less corpal and ramal dimension, angles inverted in female. Palate U-shape in male and parabola in female. So palate is inside the mouth where the upper teeth are located. So the shape is U-shape in male and parabola in female. Knuckle lines are more prominent in male than females. Teeth of male are large and more often 5-cusped, whereas female teeth are small, molars most often 4-cusped. Glabella is strongly developed in male and weakly developed in female. The forehead is sloping or slanting in male and bulbous or vertical in females. The foramen magnum, it is the hole through which the spinal cord get attached to the skull. So it is large in males and small in females. Symphysis menti or chin is square in male and round or pointed in females. Now the glabella is present between the eyebrows. So this is glabella, this is supraorbital ridges, these are the orbits, the mastoid process, the cheekbone, chin. Now you have to compare all the discussed differences from this picture. Now male versus female pelvis. So first we'll talk about the structure of pelvis. So this is the base of sacrum, this is iliac crust and this is iliac fossa. This is ilium, pubic bone, ischium, pubic arc, pubic symphysis, coccyx, sacrum. Now sex determination through pelvis. So pelvis as a whole is massive, rugged, marked, muscular sides in male and less massive, gracile, smoother in females. The symphysis, pubic symphysis, is higher in male and lower in female. Obturator foramen is large ovoid in male and small triangular in females. Acetabulum large, directed laterally in males, small, directed anterolaterally in females. The subpubic angle V-shaped sharp angle 70 to 75 degrees acute in male. Obtuse angle U-shaped 90 to 100 degrees in female. Greater sciatic notch, smaller, close, deep in male, large, wider and shallower in females. Ischiopubic rami is slightly everted in male and inverted in female. Sacroiliac articulation is large in male and small in female. Sacrum is longer and narrow in male and shorter and broader in females. True pelvis is relatively smaller in male and oblique, shallow or spacious in female. Pelvic brim is heart-shaped in male and circular in females. Pubic index, ischiopubic index, Washburn index is 73 to 94 in male and 91 to 115 in females. The index is given by the formula pubic length by ischial length into 100. So the main two differences, the acute angle formed by the pubic arc and the obtuse angle in case of female, heart shaped of pubic pelvic brim in case of male and circular pelvic brim in case of females. The sacral index in male is 105 and in female is 115. The base wing index in male is 65, female is 80. Corporobasal index is more than 42 in male and less than 42 in female. Sacroiliac articulation 2.5 to 3 vertebrae in male and 2 to 2.5 vertebrae in female. Chilotic line index is more than 100 in male. Sciatic notch index is 145 in male and Washburn index is 73 to 94 in males. Now the Krogman's degree of accuracy in sex determination of adult skeleton remains. So if we have the entire skeleton, there is 100% degree of accuracy. If we have pelvis and skull only, so we have 98% degree of accuracy in sex determination. If we have only pelvis, 95% degree of accuracy, only skull 90% and only long bones 80%. Now the sex determination from the teeth. The size and shape of mandibular teeth is bigger and less pointed in males and smaller and more pointed in female. The size of upper central and lateral incisor is different in male and same in female. Mandibular first molar has a fifth cusp in male and in female there is only 4 cusps. Stature estimation. So in case complete skeleton is there, so total length of skull plus 1 minus 1.5 for soft parts. The weight of dry skeleton in adult human male is 4.5 kgs. If the complete skeleton is not available, only long bones are there, so there is a multiplication factor for each long bone. So determination of stature by tibia, in males it is 123 plus 1.24 into tibia length in centimeter. In females it is 146 plus 0.341 into tibia length. Now the if humerus is present, the multiplication factor would be 5.2. In case of radius it is 6.5, ulna 6.0, femur 3.7, tibia 4.3 and fibula 4.4. So we have to multiply the length of the long bone with this multiplication factor to estimate the stature. And the stature of an individual is also estimated using its foot length. So it is approx 6.5 times of its foot length. So in case we have a footprint, so we'll multiply it by 6.5. The least square regression equation is used for stature estimation from long bones. Carl Pearson formula is used to determine stature from single extremity bone. Trotter and Glaser, they estimated the stature of male servicemen belonging to different races. Dupertius and Haddon, they estimated the stature of white and blacks from long bones and different combinations. Allometry is the proportional relationship of size of various body parts with stature. It is discovered by Otto Snell. And after 30 years of age, there is a decrease in the stature due to decrease in elasticity and compression of intervertebral disc and joint cartilage. Hurtel's law states that the body of sternum in male is more than twice the length of manubrium. Ashley's rule or 149 rule, it states that male sternum is more than 149 mm in length and female sternum is less than 149 mm. Harris lines are the lines of arrested growth in bones. Stell and Meckern formula is used for calculation of person's height from fragmented bones. Matejka's formula for calculation of skeletal weight from stature. So it is given by the formula W is equals to O plus D plus M plus R, where W is the body weight in grams, O is the skeletal mass in gram, D is the mass of skin and subcutaneous tissue, M is the muscle mass, and R is the residual mass. Now the stature estimation from teeth. Combined mesiodistal width of 6 maxillary anterior teeth, that is 4 upper incisors and both upper canines. So the mesiodistal width in millimeter into 13.65 plus 982.42. It gives the stature of the skeleton in millimeter. The age estimation through skull. So there are certain sutures present in the skull and they get fused depending on the age of the person. So this is anterior fontanelle and there is posterior fontanelle. There are certain sutures such as metopic suture, coronal suture, sagittal suture and lambdoidal suture. There is occipital bone and these are the frontal bones. These are frontal and these are the parietal bones. So during 2 to 3 months, the posterior lateral frontale and anterior frontale begins. During 6 months, posterior lateral frontale completes, and during 2 years, anterolateral frontale fused, metopic suture is fused and mastoid suture appears. You must have observed that in infants or in babies up to 0 to 2 years, when you touch their head, there is in this part there is a rhythmic movement or weak. This part is weak. So this is what anterior frontale is. In 20 years, phenobasal suture is fused. In 30 to 35 years, sagittal suture is fused. Up to 40 years, coronal and sagittal sutures are fused. 47 to 50 years, lambdoid suture is fused. After 75 years, all the sutures are fused. Age estimation from teeth. So the incisor, canine, premolars and molar. Incisors are further divided into central incisor and lateral incisor. So in central incisor, the upper ones are from 6 to 8 months, lower ones 7 to 9 months. Lateral incisors upper 7 to 9 months and lower 10 to 12 months. So they start appearing like that. They begin, the teeth begin at this age. And the permanent central incisors around 6 to 8 years, and the lateral incisors 7 to 9 years. Canine appears in 17 to 18 months and permanent canines in 11 to 12 years. First premolars and premolars are absent in temporary dentition, and in permanent, first premolars are observed from 9 to 11 years and second from 10 to 12 years. The molars, first and second, are present in temporary dentition. First one is occurs at 12 to 14 months, second 20 to 30 months, third is absent. The permanent molar 6 to 7 year, and second molar 12 to 14 year, and third is from starts from 17 to 21 year and sometimes may begin by 25 years of age. So order of eruption of permanent teeth is: first the molar will be erupted, then incisors, then premolar, and then canine. Some important terms related to teeth. Mamelon is the 3 bulges on front teeth. In mixed dentitions means permanent as well as the deciduous ones. So it is in mixed dentition we have 24 teeth, and this dentition is from 6 to 11 years of age, where both the temporary and the permanent teeth are present. Temporary dentition. In temporary dentition we have 20 teeth. Mongoloids are brachycephalic. The dental formula is for primary set it is 2102, incisor, canine, premolar and molar. 2102 by 2102, 2 incisors, 1 canine, 0 premolars, 2 molars. In permanent teeth it is 2 incisors, 1 canine, 2 premolars and 3 molars. So 2123 by 2123. Microdontia is dental anomaly. Permanent molars are superadded teeth. Root calcification of first permanent molar begins at birth. Polyphyodont refers to teeth that are constantly replaced. So we are diphyodont, our teeth are replaced only twice, but there are polyphyodont also, that are toothed fishes, crocodiles, geckos, etc. Stack's method deals with calculation of age from the size and weight of the incisors. All the milk teeth or the temporary teeth are erupted in human by 30 months of age. Trait of teeth. Cusp of caribally is observed in caucasoids. Shovel shaped incisors in mongoloids. Taurodontism or rectangular molar teeth, Eskimos and mongoloids. Hypodontia in Taiwanese. Now some of the identifying features of caucasoid, mongoloids and negroids. So the nasal index is less than 70 in caucasoid, 70 to 80 in mongoloid and more than 85 in negroid. Less than 70 is known as leptorrhyn, 70 to 80 mesorrhyn and more than 85 in platyrrhyn. Cusp of caribally found on tricuspids, mostly in Europeans. It is at the mesopalatal angle of maxillary first molar. It is absent in mongoloid and negroid. Brachial index, that is radial length by humerus length into 100. Brachial index is 74.5 in caucasoid, 76.49 in mongoloid and 78.5 in negroid. Crural index is tibia length by femur length into 100. So it is 83.3 in caucasoid, 86.49 in mongoloid and 86.2 in negroids. Intermembral index means the length of humerus plus radius by the length of femur plus tibia into 100. So it is 70.4 in Caucasoid, 67.27 in Mongoloid, and 70.3 in Negroid. Humerofemoral index, it is the length of humerus by the length of femur into 100. So it is 69 in Caucasoid, 71.11 in Mongoloid, and 72.4 in Negroid. Now the deformities of skull that are useful in the identification of individual. So there are craniosynostosis. One or more cranial suture fuses prematurely. So scaphocephaly, it is boat shaped skull. Plagiocephaly, anterior skew, flat head. Trigonocephaly, triangular forehead. So the features: head in dolichocephalic is long, mesocephalic medium, brachycephalic short, hyperbrachycephalic short. Cephalic or cranial index is the maximum breadth of skull by maximum length of skull into 100. It is 70 to 75 in dolichocephalic, 75 to 80 in mesocephalic, 80 to 85 in brachycephalic, and hyperbrachycephalic it is 85 to 90. The ethnic group which can be identified using these measures are dolichocephalic pure Aryans or Negroids, mesocephalic Europeans or Chinese, brachycephalic Mongolian, and hyperbrachycephalic Kyushu of Japan. Thanks for watching. Stay tuned for more such videos. Thank you.